viewers and listeners. Today we are talking about stem cells with Dr. Patrick Sewell, who does gene therapy at Integrated Health Systems. He is working with stem cells on oncology and regenerative medicine for decades now. He has worked with Harvard, Stanford, and UCLA in different areas. Also, he has worked with NASA to design, develop, and test robotic remote surgery system designed to allow doctors to operate on astronauts on the International Space Station. The link on Integrated Health Systems website below the video. And now my conversation with Dr. Patrick. Hello, Dr. Patrick. It's my extreme pleasure to have you on my channel. Thank you for joining to us today.
Yes, glad to be here.
Dr. Patrick, so my first question to you, what technology is the best for rejuvenation? Is it stem cells, telomeres, or a combination of both technologies?
Well, it's actually a combination. They all of the technologies, the stem cells, gene therapy, with lengthening your telomeres, and even PRP, which is platelet-rich plasma, which is carries a lot of the same properties as stem cells. All of those technologies have excellent benefits for rejuvenation, rejuvenating your appearance or rejuvenating your tissues so that they live longer. They have strengths and weaknesses to each. For instance, the telomeres, lengthening your telomeres will lengthen the life of the cell. And if you do all the cells in an organism, then you lengthen the life of the organism. Mm-hmm. Stem cells and PRP, or platelet-rich plasma, they are rich in ADP and ATP, which are the cellular energy molecules that your body uses to. It's the gasoline for your engine mm-hmm. and your body. And the PRP and stem cells have a lot of that in it, and they have a bunch of growth factors or hormones and chemical messengers that instruct the cells, turn things on to make the cells work better, function more efficiently, in essence, make them younger. Younger cells function more efficiently and have fewer errors. And if you and they do that because they don't have a degradation in the chemical messaging and so the stem cells and the PRP provide instructions to tell the cells to start up better and run better. So they rejuvenate the cells individually or a group of cells, and they also repair tissue damage. The telomere therapy doesn't repair tissue damage. It rejuvenates existing live cells, and then they in turn can repair themselves if needed. But the stem cells and the PRP actually cause local repair of tissue. So they help with healing and in that regard, rejuvenation.
Dr. Patrick, so with using stem cells, are we able to slow down aging, reverse aging, and extend healthy lifespan?
Well, I would have to say with stem cells, we can't extend life, but we can improve the body for the time that one's alive.
Quality, yeah?
The quality, right. The quality. The quantity of life is directly related to your telomere length on your chromosome. And the only way to extend that is through the enzyme telomerase, which is through the gene hTERT. So you have to have more hTERT gene, which we do through gene therapy. There are some supplements that people can take that activate telomerase, and they have a very, very small but measurable effect. You have to take them all the time, and they may add a very short addition to a few months or a year to your life over a lifetime of taking the supplements. The hTERT gene, if inserted with gene therapy, which is what we do with the gene therapy, can give you a decade or 2 decades or longer, depending on the dose as we move forward with the protocols. I think of it as like a tire on your automobile and putting more tread on your tire. You can retread your tire over and over again with more enzyme.
Dr. Patrick, are you aware of using stem cells by famous people to rejuvenate, extend lifespan, or treatment?
Well, yeah, there are some famous people that do, I mean, I can't tell you who they are for prime.
Yeah, I understand this.
But yes, stem cells, PRP, and gene therapy are used by wealthy people mainly because it's expensive technology. If it wasn't expensive, then anybody who wanted it could get it. Now the price comes down as we move forward and more people use it and we make advances in production technology. But yeah, it is available for anybody to use, and the limiting factor is often financial. So therefore, there are famous people that use it. Yes.
Dr. Patrick, what are the methods and application methodologies currently exist in stem cells treatment?
So there's a lot of the term stem cell is used loosely, too loosely in the press, and it's there. In the strictest sense, there's only one stem cell. The stem cell, the cell that can differentiate into any other cell in your body, and those are usually from cord blood of a baby. There are some other places to get them, but you can get them from cord blood, and they are they're very useful in that form. There are some ways to take pseudo stem cells or stem cells that are partially differentiated, like from your bone marrow or from your fat or from your skin, and modify them by inserting some genes or adding some chemicals and manipulating them, and you can undifferentiate them and make them into a pluripotent stem cell, and thereby use them for anything. But generally, the stem cell technology, people extract stem cells and use the stem cells according to where they came from. For instance, if you take a bone marrow stem cell, you can make components of the bone marrow, white blood cells, red blood cells, things like that. If you take stem cells from the fat, you can make components, soft tissue components, tendons, bones, things like that. And if you take neurological stem cells, then you can make stem cells for the neurological system. If you take cord blood cells from the placenta, they can become anything in general. And then if you take partially differentiated stem cells and manipulate them in the lab, you can make any stem cell become anything, but that's quite complex and takes some particular expertise. So people use the stem cells according to where they're extracted from, which defines how they'll be used, unless they're very sophisticated. Now, the bad press about stem cells that you'll read is about people medical professionals using stem cells in the wrong way. And that's where stem cells cause tumors or other problems. If you don't understand fully the stem cell and the various types of stem cells, and they're not all the same. So if you put the wrong type of stem cell in a certain location, it can cause a problem. So it takes some expertise to use stem cells safely.
Dr. Patrick, what kind of diseases stem cells can treat right now?
Right now, there's broad agreement in the medical literature and the medical community that stem cells can very easily treat musculoskeletal problems, arthritis, loss of cartilage, tendon regrowth, skin regrowth, scar remodeling, cosmetic procedures, healing of tissues externally, regrowing your hair, turning your hair pigmented from gray, and then that's pretty much straightforward, and everybody sees that that's reliable. The areas of interest that are not that we don't quite understand and it's not broadly accepted are treatment of neurodegenerative diseases like Parkinson's and dementia, psychiatric disorders like depression and anxiety. There's been some success in using stem cells in those areas, limited success. And then there are people who treat use stem cells to treat autoimmune disorders, and and there's mixed results there. And there's conflicting scientific evidence, so that's not really well defined now. I guess what one needs to understand is very simple systems like repairing your cartilage, stem cells are used, and it's very safe, and we understand it. And very complex systems like an autoimmune disorder, the results are relatively safe, but they may be ineffective or they might be effective. It depending on, we don't have all the answers, we don't understand it correctly. There doesn't appear to be a great danger in treating an autoimmune disorder, but there does appear to be mixed success. So that's kind of an overview.
Dr. Patrick, what are the methods for delivering stem cells to target organs?
Well, it's much like a medication. There's a direct injection, you can inject, like if you wanted to treat a knee for arthritis cartilage loss, you inject it directly into the knee joint. Or a tendon repair, you inject it directly into the tendon or right around the tendon. If you want to treat neurological diseases, you inject it directly into the neurological system, the brain, the spine, the spinal fluid, and that's controversial, and there's different ways to do it, and there are dangerous ways to do it, and there's safe ways to do it. So it takes a specialist. And then there are methods by which you can inhale stem cells to treat your lung and your airway, which are less well designed, but people are experimenting with. So in general, you have to get the stem cells to the target, and that's either delivery through the blood or direct injection with a needle.
Dr. Patrick, how are stem cells usually have injected? Is it simple process for your patients, or how it?
It's very simple. It's a simple injection. The logistics of administering stem cells for therapy is very simple. If it's a whole body treatment, it's injected into the bloodstream, and it takes 10 minutes. It's like a small infusion, and the patients are fine. They don't feel anything abnormal. They don't have a reaction. If it's an injection into a body part for repair of the body part, then it's a needle stick, and you have to anesthetize the injection site with like lidocaine, so it doesn't hurt so much. But it's just an injection with a needle, and it takes 10 seconds. It's very brief. So the act of administering the stem cells is very easy. The art is knowing what stem cells to give, how much to give, how often to give them, and where to give them and where not to give them.
Dr. Patrick, how to activate stem cells? If I understand correctly, we have like sleeping stem cells and active stem cells. Am I right?
Well, all the stem cells that I use activate themselves as soon as they enter the body. I don't know about the term sleeping stem cells myself. The ones I use are active. Now I can preserve them so they're dormant, and that lowers them to a temperature. So I would call them dormant or frozen, and they're preserved until you thaw them out. But as soon as they come to body temperature, they're active again. So I'm not sure exactly what you're referring to other than that.
Dr. Patrick, is it possible to speed up duplication process of stem cells outside the organism in vitro?
It is to a degree. There are some laboratory methods that you can use to manipulate the cells, all cells, to reproduce faster. But there are limitations, and the manipulations, depending on how you do it, there is small to medium risk of causing errors in the DNA duplication process. So it's a trade-off. In some cases, it doesn't matter if there's errors and on how you administer them. Like for a cartilage, it doesn't really matter. But in other parts, like the neurological tissues, it can cause some bad effects. Tumors, cancers, overreaction of the stem cells, etc.
Dr. Patrick, where medical professionals and scientists usually extract the stem cells for a cure? Is it in hospital labs or only in special stem cells banks?
No, it's the extraction can be done at the bedside using sterile technique in a clinic or in a hospital bed or as an outpatient. The extraction is not difficult. You take them from the bone marrow, or you take them from the subcutaneous fat in the abdominal wall, or you collect it from the blood. So it's now the processing is done in the laboratory and the manipulation is done in the laboratory, and that requires special equipment. But the collection from the patient or the donor is really simple.
Dr. Patrick, how do stem cells divide?
Well, stem cells are immortal by definition. They make their own telomerase. They make their own H-TERT gene, which makes their own telomerase. So they're one of several types in our immune system of cells that are immune. They live forever. Now they do die from physical damage, infection, or things go awry. But if left alone, they can live forever. There are some stem cells that can reproduce, but and duplicate, but the details on that are conflicting, and we don't quite understand that completely yet.
Okay. Dr. Patrick, what do you think? Stem cells treatment will be applied maybe in the near future, apply in the context of widespread medical practice?
Well, stem cells will continue to be adopted into widespread medical practice as the therapies are better defined, the individual therapy. So for a product and a therapy to be adopted into widespread medical practice, it has to be very safe. It has to be recipe done the same way every time, and the results have to be reproducible. And that's so it's not. And there are stem cells that are used widespread medical practice now in very limited ways, and will continue to expand. But usually that's done on a disease-based process, not a technology. So the application of stem cells is not what needs to be adopted. It's the methodology by who we apply it to, what diseases we apply it to. For instance, right now it's widely applied for musculoskeletal diseases, degenerative diseases of the joints and soft tissues, because it's a simple process and it's well understood. As other therapies that use stem cells are developed and they're fully understood, then they get adopted by widespread medical practice.
Dr. Patrick, question for young professionals. How to learn to accurately manage stem cells division process and their specialization?
Well, that's done by laboratory scientists, usually PhD scientists in the lab, and they have some very specialized equipment and specialized protocols that they use, and special chemicals and materials they do. It's very complex. It can be learned, but you have to go to you have to get your PhD in cellular biology, and you have to train under somebody who specializes in that, and that's the pathway. And then you are an expert in that field.
Thank you. Dr. Patrick, are there any perspectives of using stem cells in COVID-19 treatment?
Well, yeah, yes. I believe there are, and a lot of scientists do. The COVID-19, there are two parts to the COVID-19 regarding treatment. There's the mild cases, where the initial part with the viral infection, and it causes mild symptoms. And then the later on part where you get very sick because of your immune response to the virus. You get an aggressive immune response with an overzealous immune response, an overreaction. And we call that the cytokine storm. And that is your body produces a vigorous immune response, too vigorous, and the response makes you very sick. And it causes all sorts of inflammation. Stem cells squash the aggressive immune response. So they protect you when you're very sick. Stem cells can, if you start to get very sick from the cytokine storm, stem cells can suppress the cytokine storm, which can save your life. And then you can get over the virus infection like normal. The stem cells don't prevent the virus infection, and they don't treat the virus infection. They treat the abnormal immune response to the virus presence, which can be deadly.
Dr. Patrick, what are the difference between stem cells of human beings, animals, and plants?
Well, plants have stem cells, and of course animals do, and humans. In general, they're the same function in all beings. They are undifferentiated, meaning plain cells that can turn into any cell you need, and that's true in the plants and animals and humans. But they are unique to humans and unique to plants. You can't take a plant stem cell and use it in a human with any benefit of any significance. It might have some small benefit because you might be able to use some of the enzymes, but in general they're not transposable. You can't. So if you see a product using plant stem cells for humans, it's nothing more than a cosmetic product. It's not. You're not using them as stem cells. Some animal stem cells can be used in humans because there's some proximity to humans and animals. In other words, they would live and they would have an effect, but we don't have any idea what that. We can't predict what that effect is. So it's only of interest for laboratory experiments, not for therapy. So for therapy, you use dog stem cells on dogs, cat stem cells on cats, human stem cells on humans.
Dr. Patrick, could you tell me about the side effect of using stem cells in treatment?
Sure. So in general, stem cells don't cause any side effects. There are some reports in the literature of stem cells causing cancer, which I wouldn't call that a side effect. I would call it a horrible consequence of the stem cells. And that comes about when you use a stem cell improperly. If you don't understand stem cells, the different kinds of stem cells, and where to use them, if you put stem cell A in the wrong location, it can cause a tumor. And so you have to understand the different types of stem cells and where to use them and where not to use them. Other than that, stem cells are very well tolerated.
Dr. Patrick, what are the reasons of the reduction of numbers and quality of stem cells in elderly age?
So the stem cells are tied to your immune system. They're independent, but they're also tied to your immune system. And like all cells in your body, systems break down over time, and we call that aging. aging is a single word description for multifunction system breakdown in your body over time. It's a slow degradation in all systems, and the immune system is just as subject to that degradation as other systems. So stem cells, even though they're immortal and they can repair themselves, still bad accidents happen. They're fewer than in the non-stem cell population, but errors occur. And so over time, those errors accumulate, and eventually you get a catastrophic level of errors, so the stem cell doesn't function anymore, and then it dies. So it's a consequence of aging. Stem cells age less than non-stem cells, than somatic cells, but they still do age, and they're still subject to damage.
Dr. Patrick, how to improve activity and process of stem cells differentiation in elderly people?
How to improve it? Well, we're working on that right now. We believe that rejuvenating the thymus, which is a part of your immune system that involutes around age 40 to 50. We have a gene therapy that we were going to start. It's ready to go. We're going to start that trial. Well, we will be rejuvenating the thymus, and we believe that will rejuvenate all the components of the stem cells to a degree, certainly all the T cells and some of the stem cell lines too. And other than that, there's no known way to rejuvenate them. There's a lot of talk and literature out there about rejuvenating with nutritional supplements and things like that, and those may play a tiny role, but it's tiny. I don't know that you can have any measurable effect on that. So I think the only way is going to be gene therapy.
Dr. Patrick, according to United Nations statistic, babies are rarely born with cancer. Why? All
right, that goes back to we were just talking about the thymus. So the thymus is a gland in front of your heart, behind your sternum, and its main job is to teach some of the immune cells to what is body and what is not body, or what is you and what's not you. And those cells then go around your body, and when they see a bacteria, they say, "Oh, look, that's not us. That's not part of our body. That's an invader," and they attack it. They see another cell, they say, "Oh, wait, that's our kidney. We're going to leave it alone." So those cells can tell the difference between self and non-self. And when a baby's born, every system in the body, in general, unless they have a defect, is functioning at its best ever when it's born. And as it ages, it goes down a little bit. And there's a big drop off around age 40 to 50, the thymus, when it involutes completely. And so at that point, when you start seeing a rise in cancer around age 50. So many people believe, and I do too, that the loss of the thymus is the reason we see an uptick in cancer prevalence. At the same time, the thymus disappears, cancer appears in humans. Prior to that, the body is very good at telling self from non-self, and a cancer is non-self. So a baby's thymus and immune system can say, "Oh, look, there's a cancer. That's not us. That's not self. That's non-self," and it eradicates it. Hey.
Dr. Patrick, question what is very interesting to women, and you already a little bit mentioned it. How are stem cells used in cosmetology?
Well, that's a great area because it's very safe and the results are quite impressive. We can now use stem cells and PRP, which are much like stem cells, to rejuvenate the skin, to make it younger looking, to really make it younger. It looks younger because it is younger. The skin, you can grow hair back, you can grow color back in your hair. You can improve the elasticity in the skin. You can reduce the fat in certain areas, improve the tone. So basically, they're injected directly into the dermis using a needle system called a microdermal system. And the benefits are amazing sometimes. I mean, I've seen patients that look 20 years younger than they are because they've had stem cells and PRP in their facial skin. So it's not that expensive either. So it's a growth area of cosmetology or cosmetic appearance. Yeah.
Yeah. Dr. Patrick, how do you see the future of using stem cells in treatment?
I've recently come to the conclusion that I should not use, if I use stem cells, I'm also going to use PRP because that combines the two and it provides a lot more ATP energy. So when the stem cells are introduced, they have a plethora of energy to do their job. And I think we're going to continue to see the combination of those two. We're going to continue to see improvements in appearance, physical appearance, also some benefit to internal organs. It's going to compete with gene therapy to a degree, but I think there'll be some complementary roles of stem cells and PRP with gene therapy as well. So the main use of stem cells is going to continue to be with the musculoskeletal system and the cosmetic appearance and the appearance of people. But I think we're also going to start to see some improvement in tissue function when we combine it with gene therapy too.
Dr. Patrick, what should people take away from our conversation about stem cells and maybe longevity?
So the important thing about stem cells is that there are reported incidences of cancer caused by stem cells. There are very few instances. There are a handful and millions of people treated with stem cells. And those, I've reviewed many of those cases, and I believe they are from the improper use of the stem cell. It's very uncommon. 1 out of 30 million people maybe might get a cancer from stem cells. Your chance of getting cancer is greater if you go swimming in the sun, I think. So it's rare. So that's one reason. One takeaway is stem cells are generally very safe. The other takeaway is the stem cells are effective and can produce your desired goal if used correctly. So the safety and the desired effect depend on proper use. And so that depends on the knowledge of the administrator. The doctor doing the stem cells needs to know what they're doing. So you want somebody who knows, who's educated properly with stem cells. Those are probably the two most important parts of the takeaway message. They're not dangerous. They're very safe. They are effective if used correctly. There are different ways to use them. And there are ways you don't want to use them, mainly because they won't work, not that they're dangerous. And if you use them properly, they do work very well.
Dr. Patrick, thank you so much for your valuable time, for sharing with us such a useful information. And I hope to see you again on my channel. Thank you for being with us today.
Thank you.